The Knee Academy is a pre-surgical educational presentation provided by Alaska Regional Hospital's Certified Total Joint Program. We will be reviewing information on preparing for surgery, preparing your home for recovery, and what to expect while here at the facility. This educational information does not replace instructions provided by your surgeon or their staff. If discrepancies are noted, always follow your surgeon's specific instructions. In order to prepare for total knee surgery, it is important to understand some of the basic anatomy of the knee. We will be focusing on the skeletal, muscular, and other structures as they relate to your knee. The knee is a hinge joint formed where the thigh bone or femur and the shin bone, the tibia, and the kneecap, the patella, meet. There are various muscles that control movement, ligaments that give stability, and two types of cartilage. The first cartilage is the articular cartilage that lines the surfaces of the knee joint, and then a meniscus, which is a thick layer of cartilage that acts as a shock absorber. The joint space is defined by a thin layer of tissue called synovium. Synovial cells produce a slippery fluid to lubricate the knee, allowing it to move smoothly and freely. A healthy knee joint bends easily and painlessly. A problem knee is stiff or painful. The cartilage wears away due to usage, inflammation, diseases like arthritis, or injury. Worn, roughened cartilage no longer allows the joint to glide freely, so it feels stiff. As more cartilage wears away, it exposes the bones, allowing them to rub together and cause pain. A resurfaced or total knee replacement removes the roughened ends of the thigh bone, the femur, and the tibia, the shin bone, and replaces them with metal and strong plastic components. Also, the back of the patella can be removed and replaced with a plastic-like component. This new smooth surface allows the joint to glide freely so you can walk and move with greater comfort. Surgical techniques vary from surgeon to surgeon. You may want to discuss the placement of your incision and how your incision will be closed. You may also want to discuss the implants and whether these implants will be cemented or uncemented. Please understand that despite the technique used, the desired outcome is still the same: a quality, functioning knee without pain. Remember, you will get out of your surgery what you put into it, especially during the recovery phase. It is important after total knee surgery that you perform physical therapy for several weeks to regain the strength and motion in the knee. As with any type of surgical procedure, there are certain risks associated with knee surgery that your surgeon will discuss. Though complications are rare and extensive measures are taken to minimize these risks, it is important that you are aware of these possibilities and some actions to minimize them. Stiffness or a feeling of tightness is one of the complications after total knee surgery. Prolonged stiffness may make regular activities difficult. Range of motion exercises before surgery can improve your outcome after surgery. Surprisingly, a negative attitude after surgery can be associated with prolonged stiffness. People with a negative attitude are less likely to follow a physical therapy protocol, which is very important to do. Physical therapy will assist in easing your stiffness and reduce the risk of abnormal formation of scar tissue that will limit knee movement. Physical therapy and a structured home therapy program will significantly produce a better range of motion, which is how well your knee can flex and extend. Implant failure and component loosening. Fall prevention after surgery is critical during that recovery phase. If you are admitted for observation after surgery, you will see signs throughout the hospital saying, "Call, don't fall." It is important to call for assistance when getting in and out of bed, in and out of a chair, and on and off the toilet, and also especially during ambulation. We ask that you always call staff to assist you with these activities. Carrying excess body weight and some high-impact activities can cause excess strain on the artificial joint and cause it to wear out early. Life expectancy of most implants is in the range of 15 to 20 years, possibly longer. Infection prevention begins before surgery, and nutrition plays a vital role in healing. Protein is the building block of cells. Good sources of protein include lean meats, poultry, fish, eggs, dairy products, beans and legumes, and nuts and seeds. You should increase your lean sources of protein before surgery and during the recovery phase. Protein supplements can be beneficial after surgery if you have decreased appetite. Vitamin A, C, and E are antioxidants that play a key role in immune function. Vitamin C can be found in citrus fruits, strawberries, kiwi, broccoli, and bell pepper. Good sources of vitamin A are liver, sweet potatoes, carrots, spinach, and kale. Vitamin E can be obtained from spinach, nuts and seeds, fortified cereals, and vegetable oil. Vitamin D helps the body absorb calcium and reduces inflammation and boosts the natural immune response of our body. Our bodies produce vitamin D from the ultraviolet rays of the sun, so get out and enjoy a nice sunny day. Many people, especially Alaskans, don't get enough vitamin D from the sun. Foods rich in vitamin D include fatty fish like salmon, beef liver, egg yolks, and fortified with vitamin D milk and some breakfast cereals. Also, cheese, yogurt, and dark chocolate are good sources of vitamin D. Omega-3 rich foods help reduce inflammation and promote healing. These can also be found in fatty fish, walnuts, chia seeds, and flax seeds. Ensure you are getting enough calories because your body's energy needs increase during the recovery phase. Concentrate on whole foods instead of more processed foods. Smoking can interfere with anesthesia and decrease the blood supply to an area that is healing. Stop smoking before surgery as early as possible. Even a few days before surgery can be beneficial. High blood sugar levels can increase your risk of infection and delay healing. Stress can also increase blood sugar levels. We may be checking your blood sugar levels throughout the surgical process. Low body temperature or hypothermia can also have an effect on infection potential. You will be provided an air-forced warming blanket in the preoperative area and a warm blanket for transfer to the operating room, which is normally very cold. Our goal is to maintain your body temperature and prevent hypothermia. Nasal screening for Staph aureus is required for all total joint patients prior to surgery. A positive staph test does not mean you have an infection or that you can't have surgery, but it does mean you are at a higher risk for an infection. The antibiotic given before surgery depends on the results of this test. MRSA, which is methicillin-resistant Staph aureus, does require an additional antibiotic. Your surgeon may also prescribe an ointment called mupirocin to place inside your nostrils twice a day for 5 days prior to surgery, and also request that you take additional chlorhexidine showers. For all total joints, we provide a product that is an alcohol citrus solution to treat your nostrils while in the preoperative area. Your preoperative nurse will explain this process and provide you with instructions. Chlorhexidine showering is requested both the night before surgery and the morning of for all total joint patients with an antimicrobial soap. This soap may be provided by your surgeon. You can pick that soap up at our registration desk, and also if you do your pre-admission testing here at the hospital. If you are unable to obtain this special soap, you may use an over-the-counter soap like Gold Dial. We will discuss the exact process of this shower a little later in the presentation. Sterilization of surgical instruments and minimizing traffic in the operating rooms are also important to infection prevention and are things we strive to make sure we maintain. Bleeding excessively during surgery can be prevented. You will be required to stop anticoagulant medications. Those include some of the over-the-counter medications like aspirin, ibuprofen, and many herbal supplements. Discuss all medications with your surgeon. Medications like Ozempic and Jardiance also need to be discontinued prior to surgery. Most medications need to be stopped anywhere from 3 days to 2 weeks prior to surgery. You can take Tylenol, as Tylenol does not affect bleeding. Blood clot prevention is important after surgery, as blood clots can occur up to several weeks after the procedure. You will be prescribed a blood thinning medication to begin after surgery. It is important to follow medication instructions, including the length of time to take this medication. Blood clot prevention can be maximized substantially with early and frequent ambulation, movement, and foot pump exercises. While in the hospital, you will be provided with a sequential compression device machine, which we call our SCDs. These are special leg or foot wraps connected to a machine that inflates and deflates the wrap. The pumping action acts like your muscles to help blood flow and prevent blood clots. You will also be wearing compression stockings or TED hose that you will be required to wear for a few weeks after surgery. You may remove these hoses daily for an hour or so to let your legs air out and to monitor your skin for any irritation. After discharge, walking every 30 to 60 minutes and performing the foot pump exercises along with taking that anticoagulant medication will be important to prevent blood clots. Nerve irritation or nerve damage can include feelings of numbness, weakness, tingling, burning, or prickly sensations. A tourniquet may be placed on the upper thigh while in the operating room prior to surgery, and if inflated, it restricts blood flow to the operative area. You may notice some bruising, swelling, and some mild pain in that area if the tourniquet is inflated during surgery. Nerve injury from tourniquets are rare but possible. The area around the knee has several large nerves and branches. Some areas around the operative site, especially the skin, is full of nerve endings. You may notice some numbness or hypersensitivity after surgery. The feeling of tingling, burning, that pins and needles feeling indicates that your nerves are awakening. Nerves regenerate slowly, and these feelings should resolve with time. Discuss with your surgeon if those feelings continue for a longer period of time. Need for additional surgery may result from not following your preoperative and postoperative instructions, after a fall, after an infection, and sometimes after continued high impact activities that result in wear and tear on your implants. Some complications from anesthesia include nausea and vomiting and a sore throat after general anesthesia, and could include a rare chance of a spinal headache or delayed ambulation due to decreased sensation in the legs after a spinal anesthetic. If you have ever had a history of nausea and vomiting, please discuss this with your anesthesia provider prior to surgery so that you can be pre-treated to decrease that risk. Let's talk about some tasks that need to be performed prior to surgery. One of the tasks you need to complete prior to coming into the hospital for surgery is registration. This can be done by phone at 907-264-1952 or online at alaskaregionalhospital.com. Your surgeon will order some pre-surgical lab work and x-rays to be done prior to surgery. These can be done sometimes at your primary care physician, and sometimes they will need to be done here at the hospital. You will also need that MRSA swab that we talked about. Again, we accept MRSA swabs and lab work for up to 30 days prior to your procedure. We do prefer that the MRSA, the MRSA swab, is done at least 1 day prior to procedure. You will receive a pre-admission phone call that will review your medical history and medication update. Please make sure that you have a medication list that includes all of your medications and the times that you take them and that medication strength. Sometimes your surgeon will require clearance from cardiology, pulmonology, urology, or any other physicians that you normally see. The night before surgery, eat a healthy dinner high in protein. No alcoholic beverages, please. Your instructions will be that you are not to eat anything or chew gum after midnight the night prior to surgery. If you do have a late surgical time frame scheduled, you may be told that you may eat up to 8 hours prior to surgery. You may drink clear liquids that are not carbonated or caffeinated up to 4 hours prior to surgery. This includes water and Gatorade type products. You may also be given a pre-surgical carbohydrate supplement that you can drink at least 4 hours before your scheduled surgical time. This is a clear product that still follows that clear liquid up to 4 hours before surgery. This product is only available from the facility. It can be picked up at our pre-admission testing site or at the registration desk. You will be instructed on the guidelines for medications that you may or may not take before surgery. During your pre-admission phone call, when they review your medications, they will give you final instructions on what medications to take or hold prior to surgery. If you are diabetic, it is important that you have the discussion regarding the type of medications that you take and how those medications should be taken or not taken prior to surgery. As discussed, infection is a risk after surgery. We are going to talk about a pre-surgical shower to aid in infection prevention. Please do not shave any parts of your body for 24 hours prior to surgery. The night before surgery, I'd like you to get into the shower, do your normal body wash and shampoo with your normal products that you use. Then I would like you to take the applicator provided by your surgeon or a clean, freshly laundered washcloth with half a bottle of the chlorhexidine soap provided by the hospital. Once you have the washcloth wet, I would like you to turn off the water and apply that liquid soap from your chin all the way down to your toes. Again, this can be done with a washcloth or whatever your surgeon has provided for you. Please do not get that soap into your eyes or your ears. I do want you to leave that soap on your skin for at least 2 minutes. That is why we asked you to turn the water off. Once 2 minutes has passed, you can turn the water back on, rinse off well. When you do get out of the shower, I want you to dry your skin with a freshly washed towel. And I would like you to get into clean bedclothes and sleep in freshly laundered sheets. The morning of your surgery, we would ask that you take another shower. It is not necessary to shower with your normal soap and shampoo. We would like you to perform the shower as described on the previous slide from the night before with that same chlorhexidine soap. Remember, after applying the soap, leave it on your skin for about 2 minutes prior to rinsing. After coming out of the shower, we would like you to put on clean clothes that you can wear to the hospital. Remember to wear something that is loose-fitting and easy to put on and off. Some of the worst things to wear are blue jeans or yoga pants. The morning of surgery, after your shower, please do not place any lotions, perfumes, powders, or deodorant on your skin that morning. Now let's move on to the day of surgery. When coming to the hospital, I would like you to leave certain things at home. That includes large amounts of money, all medications. Please bring a list of medications, but please do not bring any medications to the hospital. Leave any valuable items and especially all jewelry at home. You may bring your phone and a charger, but we prefer to limit any valuables to having your family bring them once you are up in your room. Also, please do not bring preconceived negative notions. Having a good positive outlook is important to have a good recovery after your surgery. There are some items that we definitely would like you to bring to the hospital. One of those is your insurance card and identification. Bring a list of all your regular medications, including the dose, the frequency, and when you had last taken that medication. You can bring personal hygiene items like deodorants, toothbrush, toothpaste, although we do have a toothbrush and toothpaste that we can provide for you. We do not have deodorant, so you may want to bring your deodorant. Make sure that you have comfortable clothes that you have worn in, which you can also wear home. But we also suggest that you bring a pair of shorts or some type of pajama bottoms that you can wear while ambulating in the hallways to maintain your modesty if you are wearing our hospital gowns. A CPAP or a BiPAP, if used at home, should be brought to the hospital. Bring the unit and your mask, and we will provide the water. It is important that you have something to distract yourself or help relax after surgery. Sometimes people prefer to bring music, CD players, those types of things. We do have direct TV in all the rooms, and we do have internet capabilities, but please remember this is an unsecured internet, so don't be looking up at your bank account or buying things online where you have to enter personal information. Bring your glasses, hearing aids, dentures. Those will be important through your recovery phase. You will need a walker on the day of discharge. While you are in the hospital, we will supply a walker for your use, but we would like you to have a two-wheel walker in your vehicle so that on the day of discharge, you will have that walker to get from your vehicle into your home. Most importantly, we do want you to bring that confidence in yourself. We are here to help you, and we know that you're going to do well. You need to have that confidence in yourself that you will do well also. On the day of surgery, you will be coming to the hospital about 2 hours prior to the scheduled start of your surgery. You will come in and check in at the registration desk, which is on the second floor. They will send you down to the operating room waiting area, and I would suggest that you also check in at the reception desk there to let them know that you are in the area and ready to proceed. A nurse will come out and take you into that pre-surgical room where you will be prepared for surgery. They will get you in a hospital gown, start an IV, and you will also meet with your surgeon and anesthesia provider while you are in that room. Ask about the texting system and patient access code that we use to provide progress updates. Again, your surgeon, anesthesia provider, and operating room nurse will all visit you in that preoperative area. Your family and friends will be asked to leave during your procedure. You may have 2 members of your family in that preoperative area with you until you are taken to the operating room. After surgery, you will be taken to the recovery room. Sometimes you will hear the PACU, P-A-C-U, used as a terminology for the recovery room, which stands for post-anesthesia care unit. Your surgeon will speak to your family or whoever you have designated for him to speak with by phone after the completion of your surgical procedure. We do allow visitation after you have been removed from the recovery room and taken either to your hospital room or into phase 2 recovery where you will be prior to your discharge if you are doing outpatient procedures. Let's talk about post-operative or after surgery. Once the anesthetic begins to wear off, you will be moved to phase 2 recovery if you are going home, or to one of the hospital rooms for observation in the Orthopedic and Spine Center. This is a picture of the hospital rooms on the orthopedic unit. All of our rooms are private rooms. They all have private baths that accommodate walkers. Our total joint program has received the Joint Commission Golden Seal of Approval. We are considered a certified total joint program. While you are here for observation, you will have an orthopedic care team that includes a charge nurse who oversees the orthopedic unit, a bedside nurse who will be assigned specifically for your care. All of our nurses in the facility wear navy blue. You will also see nursing assistants or patient care technicians who wear a plum-colored uniform. You will see physical therapy and occupational therapy, and we will talk about the differences in therapy and how that will pertain to your recovery. Our therapists do wear green scrubs. Of course, your surgeon is the main part of your orthopedic care team, but there are times that he will ask a hospitalist to also come and be involved in your care. When you arrive in your hospital room, expect the following equipment. The first is oxygen, which is delivered through a flexible tube with small prongs that are going into the edge of the nostrils. You will have a pulse oximeter that is measuring the oxygen concentration in your blood. Our goal is to have that oxygen concentration to be at least 93% even while sleeping prior to removing the oxygen. You will have IV fluids and potentially IV antibiotics. Once you are taking fluids and food by mouth, we can discontinue the IV fluid. We will have the IV itself remain in place until discharge in case we do need to give you additional fluids or additional medications. You will have those sequential compression device wraps on your leg. Again, those wraps will be on anytime you are lying in bed or sitting for any longer than 30 minutes. You will also have compression stockings, the white TED hose that you may be familiar with. These compression stockings are usually requested to be worn for at least a couple of weeks after surgery. We will provide you an additional pair of stockings so that you can remove the stockings daily, allow your legs to air out, also looking at your legs to make sure that they are not causing any irritation, and then reapplying a clean pair. You will have a bulky dressing originally when you arrive from the operating room. This bulky dressing will be removed, usually that first post-operative day, and when that dressing is removed, you will see a waterproof dressing that is covering the incision line itself. That dressing will remain on for at least 1 week and potentially up to 2 weeks when you return to see your surgeon for that first post-operative visit. If you do need to change this dressing, we will provide you with an extra dressing and instructions on how to change that dressing. You will have a cryotherapy unit, which is also an electric ice machine. There are 2 types of machines used here at the hospital. The first one is the blue machine that we provide to all patients who have not been ordered a different machine. This cryotherapy unit will be used after surgery, and one of the easy things to do instead of having to fill it up with ice all the time would be to freeze some ice bottles or ice containers so that you can change those out instead of continuing to have to dump the ice. The second unit, which is the red one on the picture, is a unit called a Game Ready unit. This is an ice machine with some mild compression. This unit is a rental unit, and if your surgeon is requiring you to use this unit, he will make arrangements to contact a company to provide this unit prior to surgery. Please bring this unit with you to the hospital if this is the unit ordered for your recovery. Some surgeons require patients to use a knee immobilizer or a type of knee brace after surgery. Sometimes the quadricep muscle tends to be weak, which can cause knee buckling when putting pressure on that affected limb. This immobilizer will be removed when physical therapy is assisting you, and they will help to determine the need for this immobilizer for future use. Let's talk about pain or discomfort after surgery. There are 2 types of pain. The first type is acute pain. This is usually that surgical incision pain or a pain that comes on suddenly and normally passes relatively quickly. The other type of pain is chronic pain, and this is pain that persists over weeks, months, or even years. It is often the result of an injury, illness, or disease, and is normally the kind of pain that brings you to having a total knee replacement. Pain management can be successfully managed after surgery between the care team and your input. Our goal is to reduce your pain and make it manageable so that you can work with physical therapy, occupational therapy, and become as independent as possible during your hospital stay. Remember, you will probably not be totally pain-free after surgery. After surgery, you will experience that pain, that acute incisional and surgical pain. Remember, as your recovery progresses, this pain will go away with time. Here at the hospital, we use a pain scale to help our patients and nursing staff work together for pain management. Our scale is 0, means you don't have any pain at all, up to 10, which is the worst pain that you've ever experienced. Also, when we're discussing pain, it is helpful if you can be specific in describing the type of pain you have. Different types of pain do require different treatments. We are committed to treating and managing each person's pain after surgery. There are different routes which we give pain medications through to help treat your pain. IV pain medication is one way that we give pain medication, primarily in that early recovery phase. IV medication acts fairly quickly, but it does not last very long, and you can't go home with IV pain medication. So as early as possible, we will get you started on oral pain medication, or pain medication that you take by mouth. This pain medication normally takes about 20 to 30 minutes before you see the result, but the nice part is that this type of pain medication can last for hours. While in the preoperative area, an anesthesia provider will also discuss the use of a peripheral nerve block. This is medication injected around one of the main nerves that provides sensation to the knee and aid in pain control. Peripheral nerve blocks can be either a single shot block or a placement of a catheter attached to a pain ball that gives small continuous doses of medication. The anesthesia provider will discuss the nerve block with you and the type preferred by your surgeon. Let's talk about what to expect on the day of surgery. Once you arrive in the hospital room, we will have you up walking with staff. Sometimes, if you are capable, we can have you walk from the recovery room stretcher to the bed in your room. Our goal for ambulation is within 6 hours of the completion of your surgical procedure. The first ambulation, you will walk with 2 staff members. You will be using a 2-wheel front wheel walker, and we will have a gait belt on you for safety. We will be weaning you off of the oxygen based on the pulse oximeter readings. Our goal is 93% consistently. You will be using an incentive spirometer. This we like you to use about 10 times an hour to prevent pneumonia, and it also helps to expel the anesthesia gases that are in your lungs. You will be having that IV fluid and possibly IV antibiotics that we will discontinue once you are taking fluids and food by mouth without nausea and vomiting. The IV itself will be the last thing removed prior to your discharge. You will start on clear liquids and advance to solid foods once you have started passing gas, and we know that your system is capable of handling solid foods. You will see physical therapy and occupational therapy either the day of surgery or the next morning. It is important that we verify the ability to have you safely discharged to your home environment. We will be working again on that pain management. We do need to have that pain level manageable so that you can go home, but do remember that you will not be totally pain-free. We will also start you on that cryotherapy or cold therapy after surgery. This will assist in managing your pain and reducing swelling. And the main question people ask, when can I go home? Your care team determines when you are safe to go home. One of the things we want to make sure is that you can get in and out of bed by yourself or with limited assistance if you do have limited assistance at home. Independence with daily activity prior to discharge is very important so we can verify that you are safely dressing and toileting prior to discharge. We want to make sure that you are eating and drinking without nausea and vomiting. We want to make sure you are passing gas or have had a bowel movement. Not all patients have a bowel movement prior to discharge, but constipation prevention is extremely important. You have received an anesthetic. You are limited in your mobility. You may have limited fluid intake, and you have now added narcotic medication into the mix. All of these combined together will definitely cause constipation if you are not careful. Please plan on some constipation prevention prior to your discharge. Things like prune juice, apple cider, and some medications that can be as simple as a stool softener or a stool softener with a laxative can be very beneficial. Also, fiber is helpful, but do remember that if you are consuming a lot of fiber, you also need to consume a good deal of fluids. You are taking oral pain medications that are controlling your pain, and that you are walking with an assistive device, and if you have stairs at home, that you can safely climb those stairs. Prior to discharge, while working with therapy, they will want to know how many stairs you have and what side your handrail is on so we can practice stair maneuvering prior to discharge. We also want to make sure that you are performing those home exercises safely prior to discharge. How to prepare for the day of discharge. Prior to your departure, there are a few tasks that must be completed. We need to make sure that any medical equipment that you need is available, so having that walker in your vehicle is important if you are required to use a walker. Your surgeon will come in bright and early and complete your discharge order when he feels you are ready to go home. If they give you any new prescriptions, our pharmacy will verify that none of those prescriptions interfere with any medications that you are already taking. Your nursing team will then review those discharge instructions and prepare written instructions for you. Your bedside nurse or occupational therapist will assist you in getting prepared to leave the facility. And once your family has come to pick you up, we will review those discharge instructions that include medication, appointments, and therapy, and provide you with that after-visit summary in writing. You will then be taken by wheelchair to the hospital entrance and wished a speedy recovery, but again, making sure that you are aware that we are here if you need us. Let's review some helpful information for managing at home. When it comes to effective pain management, the tips that you've learned here at the hospital will also help when you get home. To get the best pain relief, Remember these important points. To use your medication only as directed. Do not take it prior to its scheduled time. Make sure that as the pain lessens, that you try to decrease the medication that you are taking or take it less often. Remember that oral pain medication does take about 20 to 30 minutes before it is effective. So make sure that you are planning your medications around activities, especially physical therapy. Use multimodal pain medications like Tylenol and other medications prescribed for you as directed. This will help decrease your need for narcotic pain medication. Using your ice machine or cryotherapy and elevating your extremity above the level of your heart will be very helpful in decreasing swelling and pain. Plan for rest periods, and please try to get a good night's sleep. You can deal with things easier throughout the day if you have had a good rest. Remember that it is very important to frequently change your position. No long periods of sitting or standing. You should be trying to get up and walk around at least every 30 minutes to an hour. We've talked about infection prevention, so it is important to keep your wound clean and dry. You may shower, pat the area dry as soon as you get out of the shower, but remember that you are not to soak in a bathtub or in any type of a pool or even a sauna where that area could get soaky wet. It is important that you follow the dressing instructions that we give you, and again, we will give you dressings if you need those after you get home. Please keep whatever dressings we supply in a clean, closed container away from kids and pets. And again, making sure that when you are changing those dressings, that you are doing that in a clean area, again, away from pets and children. Wash your hands, wash your hands, wash your hands. It is really important during dressing changes that you wash your hands before removing the old dressing, wash your hands before applying the new dressing, and washing your hands once the dressing has been applied. You are going to be watching for signs and symptoms of infection. They include redness, pain, heat, and swelling. Sometimes if you are having drainage, a new drainage or the way the drainage looks or smells could be indicative of a potential infection. Also, a fever, rise in your temperature. If your temperature raises over 100.4, you should be reaching out to your doctor. Sometimes people complain about changes in how they feel. Sometimes it's as simple as nausea, dizziness, chills, or fatigue. If you are experiencing any of these symptoms, please reach out to your primary care physician or your surgeon. You will be watching for signs and symptoms of blood clots. A deep vein thrombosis, also known as a DVT, normally occurs in the leg, and it could be where you have swelling, particularly in the calf, or pain in the calf that is unrelated to the incision site. It also could be an area of swelling that does not resolve with elevation of the extremity. You are also going to be watching for those blood clots called pulmonary embolism, or PE. Usually this will be shortness of breath, sudden onset of chest pain, or localized chest pain with coughing. If you have these symptoms, it is important that you go directly to an emergency room. Nutrition is a vital part of your overall healing after surgery. Eat several servings of fruits and vegetables. Drink plenty of fluids. Make sure that you are eating that good lean protein to aid in healing. Continue your exercises and increase your activity gradually. Make sure that you are attending physical therapy and frequently ambulating, alternating with periods of rest. Elevate your leg frequently, and it is very important that you do not place a pillow under the bend of your knee. You want to make sure that any time you are at rest that your knee is fully extended. You can place a pillow or a rolled towel under your ankle that will allow the knee itself to hang freely at the bend of the knee. Make sure that you are beginning outpatient physical therapy. Most surgeons would like you to start this within a week of discharge. Keeping a written record after surgery of some of these items can be very beneficial. The first one is pain medication. Pain medication causes you to forget, so it's easy to forget the time that you took the last medication dose. We do want you to be able to take your medication if it is time, but we do not want you to take pain medications too early. Keeping track of walks, again, begin with those short walks, frequent walks, increasing as tolerated, and of course alternating with periods of rest. Increase that distance each and every day with walking. Keeping track of exercises that you are doing, especially those provided by physical therapy, will be helpful when you start outpatient therapy so they can see your progression. Also, making sure that you keep a record of your bowel movements. Constipation is common after surgery due to narcotics, anesthesia, decreased mobility, and decreasing in your fluid intake. Remember, using things like coffee, prune juice, apple cider, mild stool softeners, and potentially stool softeners with a mild laxative can be very beneficial.
Hello, I'm Gary, an occupational therapist here at Alaska Regional Hospital. Today we're going to talk about therapy in the hospital. While in the hospital, you will receive therapy, and the goal of our therapy is a safe discharge home after your surgery. But please remember, therapy that you will be getting while you are here is going to be individualized to you as a patient and your specific discharge plan. Some patients have very high needs and will be receiving more therapy, and some patients will have very low needs and will receive just a little bit of therapy while you are here. But again, the goal will be an individualized plan for a safe discharge home. When it comes to that safe discharge, we have two major goals. The first one is going to be no falls. We will be focusing on safe mobility and activity and highly focused on fall prevention and preparation for going home. And the second major goal of therapy is going to be no infections. We want a safe home environment to keep infections away from that surgical site. So now let's talk about the types of therapy that you will receive while you're here at Alaska Regional Hospital. The first type of therapy that you may receive while you are here at the hospital is physical therapy. Most people are familiar with physical therapy, but what they will be working on is exercising, mobility, and safe activity. They may be teaching you how to go up and down stairs, focus on walking with and without a walker, or getting in and out of bed. Equipment that they will be using is a walker and a gait belt. In this slide, I wanted to show some pictures of the equipment that I mentioned in the previous slide. On the left is a front-wheeled walker. The vast majority of our patients will be recommended to use some type of equipment to help you walk after surgery. Most of these recommendations will be for a front-wheeled walker. While you are here in the hospital, you will be borrowing one of our walkers for use in the room. However, upon going home, you will not be allowed to take our walker with you. We do encourage patients to preemptively get a front-wheeled walker in preparation for discharge home. These can be acquired at local lending closets, big box stores, pharmacies, or even online. On the right is a picture of a gait belt in use. A gait belt is a simple canvas belt that goes around your waist and allows staff members or family to hold on to you after surgery in case you get a little unsteady. It allows us to correct that balance. Another topic that I wanted to discuss with physical therapy is what we refer to as activity as tolerated. For most of our total knee replacement patients, we will be encouraging you to put weight and move that knee after surgery. You will hear the term knee extension and knee flexion mentioned often while here in the hospital. Knee extension is straightening out that knee as much as possible, and flexion is bending that knee as much as possible. We will discuss after surgery safe positioning, but please note that we will want to focus on making sure that you can straighten your knee as well as bending your knee as safely and as pain-free as possible after surgery. And the last topic that I want to discuss in regards to physical therapy is how they may teach you to go up and down the stairs. The catchphrase that we use is up with the good and down with the bad, meaning that going up the stairs, you'll be stepping up with your non-surgical leg and bringing your surgical leg up to match that foot. And going down the stairs, you'll be stepping down with your surgical leg and then bringing your non-surgical foot down to match it. This is just a common suggestion, and physical therapy will work on a specific plan for you depending on your home situation and your skill level after surgery. The second therapy that you may receive here in the hospital is occupational therapy. Occupational therapists deal with what we refer to as the activities of daily living. Our catchphrase is functional independence, and we focus on those day-to-day things that we want you to be as independent as possible in, such as bathing, dressing, and grooming. We use various equipment from reachers, sock aids, and long-handled sponges, and some others that you may receive while you're here in the hospital. The most common item that an occupational therapist will use postoperatively is a reacher. Some people refer to these as grabbers. On the left, you can see a picture of a standard reacher, and in the middle, you can see somebody using it for day-to-day things such as picking up a blanket. The reacher is very handy to keep you from moving drastically to prevent falls, but as you can see on the right, it is also very good at allowing you to be able to get dressed if you're unable to reach your feet or your operative leg very easily. After surgery, an occupational therapist will be teaching you how to use these items to get yourself dressed and undressed. Another common item to assist in getting dressed is known as a sock aid. On the left, you can see it's basically a plastic tube and a rope. And with the right two pictures, you can see how it can be used to place a sock onto the frame, be thrown out in front of you, and pulled up onto your foot and up your leg, allowing you to get your socks on if you're unable to reach your feet or bend too much after surgery. So now we're going to talk about preparing and planning at home before surgery. These are things that we want you to do prior to coming into the hospital to allow for a safe discharge home. And remember those two goals of therapy: no falls and no infections, and that is what we are going to focus on in preparation for your home. Some common recommendations may include cleaning your home and vacuuming all your carpets, laundering all of your bedding and all the comfortable clothes that you'll be wearing after surgery so that way everything is ready and clean for you whenever you get home, disinfecting and cleaning your bathrooms, including your toilets, showers, and sinks, removing all clutter, especially anything on the floor that can be a fall hazard, and think about prioritizing easy access to the common use items that you will be using for the first few weeks after surgery. Think about waist to face reaching. That is a catchphrase that I use for where you should place these items to have easy access. Reaching below your waist can be very dangerous, especially with a walker, and reaching for things above your face level can also be dangerous and cause a fall. So keeping things in that zone, waist to face, will make items easy to get to after surgery. Another thing that I want you to consider in preparation of your home is the seating surfaces that you have. Consider that after surgery, you may have a difficult time getting up from low surfaces because of knee pain. Again, you will likely be allowed to put full weight on that knee after surgery, but some patients find great discomfort in standing up from low surfaces. So the way that I want you to practice this is play musical chairs at home to know whether a surface will be too low for you to sit in after surgery. So the way that I want you to do that is similar to the pictures that I have below in this slide. I want you to back up to that seating surface, be it your toilet, your recliner, your couch, even a dining room chair. And I want you to use your hands and your non-surgical leg to sit down and stand up. With your surgical leg, you'll kind of kick it out in front of you a little bit to kind of take weight off of it. This will allow you to sit down and get up with your non-operative extremities to know whether or not Again, worst case scenario, that you can get up from that surface without having a lot of push from that surgical leg. If you find that you cannot easily get up off of that surface, not using that surgical limb too much, you may want to consider not sitting in that surface or adapting it after surgery for a safe discharge home. So now let's talk about the specifics of each room in your house and how you can prepare and plan that room to be extra safe getting home from surgery. So let's talk about the bathroom first. The bathroom is a danger zone in the home and it is a high fall risk area, so please have extra care when using the bathroom. When it comes to bathing, you will not likely be allowed to soak in a tub and take a bath. When it comes to bathing, it's only going to be showering. So with a shower, we do recommend sitting down on something like a shower chair or a tub bench. If you have a standard walk-in shower, we often recommend a shower chair. If you have a tub combination where you have to step up and over that ledge, sometimes we do recommend a tub bench. Things such as handheld shower heads and grab bars make life much easier when it comes to bathing as well. And please remember, no soaking that surgical area. When it comes to toileting, please consider a riser or a frame if you've played musical chairs at home and find that that toilet may be too low for you. So now let's talk about some of those items I just mentioned. On the top left, you can see a picture of the tub transfer bench. This is basically a wide shower chair that hangs over the edge of your tub just slightly, and this allows you to back up, sit down, and swing your legs up and over the edge of that tub so you don't have to worry about bringing your feet and stepping up and over. If you are able to step up and over your tub bench, consider something like the middle picture, a clamp-on grab bar. This clamps onto the edge of your tub, similar to a vise, and allows you to have something to hold on to as you bring your feet into that tub. We normally do not recommend suction cup grab bars as they can pop loose without warning and cause a fall. So the clamp-on grab bar is our preference. On the bottom left, you can see a picture of a standard shower chair. And this is very good for a standard walk-in shower and can even fit in a tub shower, but does not provide the ability to allow you to sit down and swing your legs in as easily. On the right, you can see a diagram that shows the method of getting in and out using a tub transfer bench. Again, where you back up, sit down, and spin your legs into the tub safely. Please remember when it comes to bathing, again, no soaking that extremity, and if you do need this equipment, you can get it locally at different lending or loaning closets, big box stores, pharmacies, or even online. And now here are some of those toileting items that I mentioned. On the left, you can see a picture of a toilet frame. Sometimes these are referred to as 3-in-1 bedside commodes if you go to the store. They can be a standalone porta potty, like on the picture on the left, where there's a removable bucket at the bottom for toileting items to go into. The middle picture shows what happens if you remove that bucket and put it over top of a toilet where it becomes a riser and a frame, where you have an elevated seating surface with grab bars. If you don't have the room in your bathroom, you may consider something like on the right, a toilet riser. Some risers have grab bars built in, like the one pictured, and some don't. Please get these items prior to surgery if you think you may need them and have them installed before surgery so you can test them out. Sometimes they don't fit every toilet perfectly and you want to make sure that yours is compatible with your own bathroom. So now let's talk about the bedroom and the kitchen. I often like to talk about these two rooms at the same time because I like to reference back to my catchphrase again, waist to face. Anything below the waist or anything above the face may be tricky to reach for or even dangerous, especially if using a walker at home. For your bedroom, consider your dressers, your closet, anything that you're going to be keeping clothes in, where they're going to be set up. If your favorite socks are going to be in the bottom drawer, please consider getting them somewhere in that waist-to-face region. When it comes to the kitchen, think of your kitchen cabinets. Low cabinets and tall cabinets may be tricky to get into, so any items that you're going to be using in that kitchen, again, get them in that waist-to-face zone. Something else for the kitchen that may be very convenient is having pre-prepared meals for after surgery to make life a little bit easier whenever you get home. And whenever you are planning those meals, remember, a healthy diet with protein can help with healing and infection prevention. So now let's talk about the rest of the living space inside your home. Remember that you'll likely need ample space to move around your home with a walker whenever you get home from the hospital, but also consider the lighting in your home. Cluttered spaces and dark spaces put you at high risk of a fall. So please consider moving furniture, decluttering, and having good lighting, whether that be night lights or opening up blinds so that you can see well moving around your own home. Also, when it comes to stairs, count the number of stairs that you have in your home and pay attention to handrail location. After your surgery, physical therapy will be working with you on stairs, and we have practice stairs here in the hospital to work on for a safe discharge. Also, if you have a multi-level home with many stairs, if it is possible to live on one level in that home, consider moving things around a little bit. That way you can stay on that level and avoid stairs if possible. When it comes to furniture, I already mentioned playing musical chairs at home to make sure that a surface isn't too deep or too low for whenever you get home. So, firm chairs with arms are generally slightly better than low, deep, extra overstuffed chairs. And also be cautious of those recliners. Remember that sometimes recliners you have to use your legs to kick those leg rests down, and reaching controls may be difficult, so please practice that musical chairs with all of your furniture at home. And when it comes to rugs, generically, we want you to remove all rugs, including area rugs and bathroom rugs. They can be a fall hazard for both your feet and for a walker, and please make sure that all your walkways are clear and free of clutter. Now, when it comes to transportation, please remember that you will likely have driving restrictions based on your physician's orders after surgery. So going home from the hospital, you will be riding passenger. We do prefer you to sit in the passenger seat as opposed to trying to get into the back, because the door frames on most vehicles is larger and on passenger side to allow you to get easier in and out of your vehicle. A mid-size vehicle is generally the easiest and safest to get in and out of. Very low cars and very high pickup trucks can sometimes be very tricky after surgery. Following surgery, the technique shown on this slide is generally how we recommend most patients to get in and out of their vehicle. Just like many of the other things that we want you to do, we want you to back up, sit your butt into the seat first, and spin and swing your legs into the vehicle. This prevents you from having to lift one leg up, one leg down, and put yourself in drastic positions which could cause a fall. To get out of the vehicle, you do the same thing but reversed. You spin out of the vehicle, get your feet planted, and stand up. So lastly, let's talk about pets at home. Please have a plan for after surgery to care for your pet. This includes especially walking and feeding. We do not want you walking any pets on leashes, as that can be a fall hazard, and sometimes bending down to the ground to get water and food bowls can be dangerous as well. Oftentimes, especially with dogs, we like people to put away or restrain a pet when you first get home so they don't jump on you, and that allows you to get sitting down before your pet comes out and greets you. That way you are in a safe place. When it comes to infection prevention, pets are something we like to focus on. Please do not let cats and dogs and other pets near your incision site, and often we recommend people not to sleep with your animal at home, especially using a pet blanket or things like that to help prevent infection at that surgical site. And again, remember, therapy in the hospital will be individualized to you with the goal of a safe discharge home. So remember those two big rules: no falls and no infections. And always, please talk to your physical therapist or occupational therapist about any concerns that you may have for returning home safely. Thank you.
Gary and I thank you for viewing this presentation. We hope that it has been beneficial. To receive credit for viewing this presentation and for any questions or concerns, please contact me, Donna Kager, at 907-264-1481. You can also email me at donna.kager@hcahealthcare.com. Thank you.